Memorial Hospital is freshly blessed with state-of-the-art developments. Such progress brings new hope for the Boholanos and broadens our horizon for what is still in store for us. With the awarding of the Case Type Z Benefit Prematurity Package, GCGMH once again moves a step forward in becoming the premier medical center that it envisioned. And to give us his message in light of this momentous celebration is the founding president of the Philippine Society of Newborn Medicine, Incorporated, ladies and gentlemen, Dr. Emilio Hernandez Jr. Let's give him a round of applause, please.
Thank you. Good afternoon. The medical chief officer of the hospital, Micha, the people behind the Gallares Medical Center, I don't know all of you, Dr. Castillo, Dr. Premature, Dr. Pargas, my colleagues, okay, you know them already. Friends, ladies and gentlemen, it's quite surprising for me to deliver this speech. Last week, I received a call from Golda. Okay, I just arrived from my vacation and still sleepy. Okay, so I just take it for granted. Then the secretary of our society, the Philippine Society of Newborn Medicine, texted me that there was an invitation. I didn't respond about it because I still sleepy, still tired. And only 3 days ago, when I talked with Kismet, I inquired what is it about. And she told me, you're just invited. Okay. Then she said everything. Okay. It's invited. Okay. And I said yes, I will go because I was invited. Then last night, she called me again to talk and deliver a piece. What is that about, sabi ko? Just deliver a speech. What's your reply? She said to me. I told her, bahala na. Exclamation point 3 times. This was a surprise to me, like Kismet. Okay, I thought a while I was just here for some witness the launching of the first fee package for prematurity. Okay, nonetheless, I'm here to talk in front of you to talk about some of prematurity and also to reveal some what I know about Kismet. When she was under me. Okay. Now, there was a dramatic change in the survival of preterms from early 60s up to the present time. Remember, the baby of President Kennedy then was a premature but died because of the inadequate facilities. Okay? But nowadays, there's marked improvement in the survival. However, the survival of premature babies seems not to be achieved as defined by the MDG 15. We were not able to achieve the target goal for many reasons still. There are lots of improvements in the care. There are much advantage the intellectual people in the care of the prematures, as well as the facilities were present. First and foremost was the Philippine Children's Medical Center where Kismet graduated. It was, I'm sorry to tell it to you, that Imelda Marcos was the one responsible for building the so-called lungsod ng kabataan. Okay. It's a well-equipped, modern, neonatal intensive care unit. But still, there were some hindrances. Marami pa rin kulang bakit namamatay pa rin ang mga prematures. So there are many agencies trying to help improve the survival of prematures. As of the latest census, prematurity is the #1 cause of mortality among pediatric cases. Newborns, by the way. So, what are we going to do with it? Okay. Lots of improvement. Intellectuals than neonatologists abound. Okay. Unlike during the time when Kismet was training, we are only very few. Nowadays, we are more than 100 already. So, however, the people, even though we are more than 100, is still confined to the Metro Manila, the practice of neonatology. Only few went back to the respective areas where they started their practice. And I'm glad to say that Kismet is one of them who went home to practice and try to implement what she had gained knowledge during her training in Philippine Children's Medical Center. Also, as you can see here, Dr. Ivan went home too after the training. Okay. What's the reason why still there is the survival is not that good? There is high mortality rate among prematures in spite of the advances in the field of neonatology. It is because of our present problem, poverty among Filipinos. Many cannot afford to expend the expenses incurred during the stay of a premature baby in the hospital. And I'm happy to note that this hospital, this GCGMH, became the first beneficiary of the Z package of the PhilHealth. And I foresee that it will be a great advantage for the people of Bohol, okay, to improve the mortality rates among premature babies. Because this will help a lot among babies born to low-income families. The incidence of prematurity, by the way, is more among parents of low-income group. Okay. So, congratulations, Kismet, for working hard to be benefited with a Z package for prematures. I told you that I have to reveal some of the things I know about Kismet. Kismet is the second graduate in neonatology of the Philippine Children's Medical Center. The first one is beside her, Dr. Masangkay. Okay. Both, she was second year, Dr. Masangkay, and Kismet was the first year. Okay. Kismet, being not from Manila, seems to be unaware of what's happening in the NICO in Philippine Children's Medical Center. Okay? So sometimes I get mad at her because alam mo naman, ang Tagalog probinsya noon hindi pa exposed sa maraming gamit. Okay? So, but because of her perseverance, her energy, and her willingness to learn, she pursued. As I told, as days passes, many has quit during the training, but Kismet pursued it. There was one time when she was in second year, I asked her to see a baby in a private hospital being referred to the Children's Medical Center. She was surprised why I asked her to see. Yes, you have to go, I told her. She was hesitant. In my mind, she said, how come ako ang pinapunta, hindi siya? I tried to test her whether she can manage. Okay? And truthfully, she was able to. That was Kismet. Okay? She seems to be so, what do you call it? Happy-go-lucky at times, but deep inside, she knows what she's doing. Okay. That is Kismet Mapuno. Kismet is also, at times, during her duty, disappears. What's the reason why? Because the husband arrives. Okay? I understand it because she's from the province. Okay, there was a distance love affair. Okay, so at times when the husband comes, okay, she will try to disappear for a few hours. But I know. But I don't tell her that I know that she is missing certain hours. But when she comes back, she tried her best to finish all the jobs assigned to her. And that was again Kismet. My congratulations to you, Kismet, for your achievement, your industry, your knowledge, as well as your energy. You have improved the lives of premature babies, especially from Bohol. I am proud that I was once a part of your life in the way, in training in neonatology. And I hope many will follow the footsteps of this man. Magandang hapon sa inyong lahat.
Thank you, Dr. Hernandez. That was quite revealing. Okay. News of this project made GCGMH a buzz. Many have inquired of what this venture is about, what it will offer to the people, and what benefits may the community reap from this endeavor. To give us his message for this ceremony is the Acting Senior Vice President, Health Finance Policy Sector of the Philippine Health Insurance Corporation, Dr. Israel Francis Pargas. A big hand, please.
Colleagues in the health service, good afternoon. Just like the good doctor, I was invited. And then here I am now giving a message. So akala ko rin po ay ito ay isang pagpunta lamang, kundi ito pala isa rin pagbibigay ng mensahe. But again, colleagues in the health service, good afternoon. And I'd like to thank everyone. I'd like first to start the message thanking everyone, especially our partners in the development of this particular benefit. PCMC is here, UNICEF is here, of course our people from PhilHealth, and all others who actually were part of the development of this particular benefit. It took a while. I think it was a long development process within the corporation, and again it took a while before we can actually implement it. We came out with a particular policy circular in 2017. It was signed then by still the secretary, I think, is Pauline Obiad, Dr. Obiad, and the implementation starts with the time of Dr. Duque right now. So again, I'd like to start by saying congratulations to the first ever contracted hospital who will actually implement the particular policy on the Z benefit package for children for premature and small newborn babies. And it is our Governor Celestino Gallares Memorial Hospital. So congratulations po sa inyo. Medyo matagal din, no? Kasi we came out with a circular in 2016 pa actually for the guiding principles, and then the circular itself in 2017, and then implementation ngayon nga lang po nangyari. And during those times, actually, from the development process to awaiting implementation, because wala pa pong nagpapakontract, we already had discussions with our partners like UNICEF on how actually we can improve the process, one on the communication, marketing, and making sure that there are facilities who will actually implement this particular policy. And so, well, konting kwento lang po, there were several hospitals which applied for this package. At tinitingnan po natin, sino kaya mauuna? Sino ang makaka-comply? Because there are, one of the reasons why is probably there are more requirements for this particular Z benefit packages because, well, it is the services that we provide are coming from not only for the management of a premature or a small newborn baby, but even preventing the preterm delivery. So medyo marami po tayong requirements. So tinitingnan natin kasi there are hospitals which apply coming from here, from the north, from the south. So sino kaya yung unang kompleto ng requirements? And so pabalik-balik ang papel because as they apply, may makikita na naman kaming kulang. Hindi lang po ito yung sa Gallares, but all other hospitals. Until parang isa na lang yung nagkukulang na requirement dito at dun sa isang ospital. So again, sino kaya yung mauuna sa dalawa? But you know, yes sir. But you know, well, Dr. Mutia was really in her earnest desire to really care for the premature babies and the small baby. Siya po personally ang nagpa-follow up. She even went on going to PhilHealth personally. Especially yung nalaman na po nila na okay na, kompleto na, for MOA site, for signature na lang of the MOA ng PhilHealth at ng ospital. So siya mismo ang nagpupunta sa PhilHealth para doon na permahan, yun na kailangang email, para lang po mapabilis yung proseso. So that's how dedicated she was, and that's how her earnest desire really for the Gallares, not to be the first, but really to provide this particular benefit for everyone who would need it. Not only, again, the babies, but also the mother to prevent the premature delivery. So, this particular benefit package actually supplements the efforts of the Department of Health and the national government in making sure that the mortality of the under 5 are reduced and further reduced. Alam naman po natin that the major reason, especially in the Philippines, of the under 5 mortality is the prematurity. They say, data would say, it's like 14.4% worldwide. In the Philippines, it's 60% of the cost of the under 5. And hopefully, this particular benefit package supplements the efforts of the government. This particular policy also complements the benefits of PhilHealth being provided to our mothers. We have packages for maternity care, for our normal spontaneous delivery package. We have our newborn care package. We have case rates and packages for those children who are born premature or small. But this one complements those particular packages right now because ito pong pakete na ito ay isang pakete ng kabuuan ng unang pag-aalaga sa ating mga buntis na mga kababaihan na huwag manganak na prematurely at kung mangyari man na makapanganak prematurely, yung mga bata ay mas maaalagaan natin at masisigurado na mabibigyan sila at mabubuhay. So, at the end of the day, ito pong ating beneficio na ito is a supplemental and it's a complementary benefit to all the other efforts of the national government and the Department of Health. And we are very much appreciative of the fact that the Governor Gallares Memorial Hospital has actually accepted the challenge of one, being a contracted facility, and second is really to support those efforts by the government too. Ito pong pakete na ito would have different benefit payment rates depending on the services that will be provided by the hospital. Pero dito po ay makikita na rin natin na itong isang kabuuang benepisyo para sa mga kabataan or sa mga baby na ipinanganak prematurely kung nangangailangan ng iba't ibang serbisyo. Kaya po sinigurado natin na ang isang ospital na ikokontrata ng PhilHealth ay kompleto ang unang-una ang mga pasilidad, yung pong mga equipment necessary to deliver the services, and kompleto rin po ang mga gamot, at meron din pong mga tao or human resource personnel na magpo-provide ng ganitong servisyo. No? So, ito naman pong benefisyong ito, katulad ng ating iba pang Z-benefit packages, is a more or less complete benefit package para po maitustusan yung pangangailangan. But meron pa rin po akong call for the Gallares or any other hospitals who may be present here today. This is not the only Z-benefit package that we have. We have other Z-benefit packages which I hope your facilities, after having, especially for the Gallares, having it contracted for the Z-benefit for prematurity and small newborn, sana po you could also work on other Z-benefit packages katulad po na Z-benefit for acute leukemic lymphocytic leukemia. Again, Dr. Gallares, because your heart is with the children, we know that the ALL is the most common amongst children, and we have a Z-benefit for that. So also sana po later on, you can also work for the hospital, again, to be the first here in your area in Bohol to be contracted for such. And all other Z-benefit packages that we have. We have right now 19 Z-benefit packages which are directed towards our more or less catastrophic cases. And that goes not only for Dr. Mutya, but all the other chief of hospitals who are here. That is again a challenge being posed to you by PhilHealth. Na sana po ay halos lahat ng ating mga benepisyo ay maibigay natin sa ating mga kababayan. Yun naman ang ninanais natin. Dahil alam na po naman natin na unang-una, magkakaroon ng limitasyon. Gaya nga ng sabi natin, sa ngayon, it is Gallares who is the first and the only one currently for the premature Z-benefit package. So, limitado ang maaaring mabigyan ng serbisyo. Dahil yung mga taga-Maynila, hindi naman nakangailangan pumunta pa sa Bohol para lamang makakuha ng Z-benefits. The idea is the access for those benefits or for these benefits is open to almost everyone. Kaya nga po, we congratulate Gallares for accepting the challenge, but we also pose the challenge to all others who are here to sana to accept and respond. Because, as I've said earlier, this policy is supplementary and complementary to the efforts of the government, but this policy is also a response to the need. This is a responsive benefit, which is part of the mandate of PhilHealth, particularly in moving forward the universal health coverage. This is a need not only to answer the promises and not only to answer our how do you call it? Our commitment to lower the under 5 mortality, but really because we need our premature babies who are born prematurely and small need this particular service benefit. So again, I'd like to congratulate the Gallares for all the efforts. But I'd like congratulations po. At sana po ay patuloy natin na maisaayos ang pagbibigay ng serbisyo. But more importantly also, I'd like to congratulate all our partners, UNICEF, again PCMC, and all the others who are part in developing this particular package. And I do hope that hindi lang po dito, but marami pa rin tayong pagtutulungan in the service of our Filipinos. Lalo na nga po ngayon na sa parating na UHC, wala na pong pinipili. Lahat ay sinasabi ng miyembro ng PhilHealth at makakakuha dapat ng benepisyo. So ang prayer namin ngayon is, everyone, may we continue to be partners in health. Good afternoon and thank you very much.
Thank you, Dr. Pargas.